Hello, everyone, and welcome to our Supporting Families and Youth Experiencing Poverty Through PrEP Programming webinar. We're really excited to have a webinar brought to you today from Hannah Lantos and Jenita Parekh at Child Trends. And after they share their presentation, we're going to have an opportunity to hear from some subrecipients working across the country to address and support youth in poverty through their PrEP programming. We're going to get started with a video.
Millions more Americans have filed unemployment claims.
Many Americans face the new challenge of putting food on the table.
Even before the pandemic,
I haven't had any income coming in since before COVID started.
Deepened the country's economic divide.
Please let them be strawberry.
Millions of children were living in poverty.
Thank you. Have a good one.
We have a lot of kids that come to school and they rely on us they come hungry.
In places like Ohio.
Sometimes this is probably the only meals they get. I don't think any baby ever thought we'd be doing this, you know? Yeah.
Home to some of the poorest communities in the country.
Being a single mom, it's hard. You know, if I could feed my kids without having assistance, you best bet you I would, but I can't.
Flour, salt, the chicken or
beef, if you have beef.
From the start of the crisis, Frontline followed 3 children and their families.
When we say we don't have money, we really don't.
I have no home. I can't provide a home for my children right now.
I walk to McDonald's because they have a free lunch for school-age kids.
As they navigated months of uncertainty.
If we can't finish the rest of the year, we may get held back again.
If they keep these schools shut, I'm going to go crazy. I cannot teach her.
If I feel sad or something and I express to my mom, that'll make her feel sad. And so I usually just would keep it to myself. I couldn't imagine living like this forever, and I don't want to live like this forever.
Now, the experience of growing up poor in America through the eyes of children.
I think anyone can end up how we are, being homeless.
When I get older, I wouldn't want to live here. I want to get a good, stable job.
I can't.
It's all right.
No, I can't concentrate. There's way more kids like this is going through the same thing as we are, because sometimes life just happens and things go the wrong way.
Good afternoon. My name is Hannah, and I'm joined by my colleague, Jenita. We are both reproductive health researchers at Child Trends. Jenita and I are honored to be with you here today to speak about trends in child poverty and how to use your PrEP programming to support participants who are experiencing poverty. While some of your participants and their families were struggling with poverty long before the current pandemic, others are now faced with new challenges due to job loss or family illness over the past year and a half. We hope the conversation today is useful as you think about supporting your participants and their families. We started off today's presentation with the first 2 minutes of a Frontline documentary about growing up poor in America, because we felt it did a really nice job of framing what poverty looks like for far too many Americans across races and ethnicities, geographies, and backgrounds. It looks like hunger, housing instability, a desire for a better future, frustration, and a lack of focus. This is the world that all too many of our children are growing up in and whom your programs serve. Before we dive into the rest of the presentation, the entire documentary is available free of charge on YouTube and is a powerful film. While we don't have time today to watch all of it, we will share the link in the chat if you want to watch it on your own.
Before we can talk about poverty, we need to talk about how we measure poverty. Cutoffs for poverty are measured differently in different countries. But in the United States, we measure it by comparing a person's or family's income to a set poverty threshold, or minimum amount of income needed to cover basic needs. This cutoff, or called the poverty line, is defined by the number of people in the household and the amount of income those people have. People whose income falls under that threshold, the poverty line, are considered poor. In 2021, the poverty line for a family of 4 is $26,500. If a family of 4 lives below this, they are considered poor. If they live between this and twice this, $53,000, they are considered low income. In the United States, the Census Bureau is in charge of the official poverty measures. They calculate poverty in 2 different ways: the official poverty measure and the supplemental poverty measure. While it is not important that you understand all of the details that go into these two measures, we wanted to highlight a couple important things to know. First, there is an important difference between the two measures that comes up when comparing children's poverty in particular. The supplemental poverty measure tends to show lower rates of children's poverty because it includes some non-cash benefits, such as familial income. This results in some households reporting a higher level of income. Second, you will likely see the official poverty measure reported more often than the supplemental. Sometimes you will see different numbers. This isn't because the numbers are wrong, but because they focus on different measures. Additionally, sometimes when we focus only on statistics, we forget that poverty is a human experience. So in the next slides, we'll move a bit away from the statistics to more narrative.
As a researcher who was extensively trained in quantitative research methods, graphs and statistics make me excited. I know, I'm a nerd, but I also love the narrative and the human story that qualitative research provides for us. In this slide and the next slide, we share quotes that shed light on what it looks like or even feels like maybe to be poor. The quote I'm about to read is from a book called Evicted. In this quote, Arlene, who is one of the Milwaukee residents the author studied in depth for the book, has just been evicted by her landlord. Her landlord believes she is responsible for the fact that someone broke the door to the apartment when they tried to break in. The author describes that day as follows. The January day that Arlene and her boys had to be out was cold, but if she waited any longer, the landlord would summon the sheriff, who would arrive with a gun, a team of boot-footed movers, and a folded judge's order saying that her house was no longer hers. She would be given two options, truck or curb. Truck would mean that her things would be loaded into an 18-footer and later checked into bonded storage. She could get everything back after paying $350. Arlene didn't have $350, so she would have opted for the curb, which would mean watching the movers pile everything onto the sidewalk. Her mattresses, a floor model television, her copy of Don't Be Afraid to Discipline, her nice glass dining table, and the lace tablecloth that fit just so. Silk plants, Bibles, the meat cuts in the freezer, the shower curtain, Jafari's asthma machine. The second quote that I'm about to read comes from a researcher named Kathy Eden. She has done work on the dynamics that have created more extreme poverty in the last 30 years. This text comes from recent work she's done, and she shared it when testifying in front of Congress in April 2020. Ray McCormick had worked at Kmart since she was 17, but it closed about the time that a Walmart came to the neighborhood. After obtaining a cashier's job at Walmart, she set her sights on winning Employee of the Month. She did so 2 times in her first 6 months. To get to and from work, Ray paid her landlord, a family friend, for the use of his truck, putting what remained of each check in the tank each Friday when she got paid. One Monday, she set out for work only to find that the tank was empty. Her landlord had used up the gas running errands over the weekend. Unable to find anyone who could lend her any cash, she called up her manager, hoping for a loan or a ride. Neither was forthcoming. Ray lost that job. We share this quote to bring to life what poverty can look like for someone on the ground, but also to highlight how being poor sometimes, ironically, actually costs more. Navigating the systems takes time and money. Paying to store your stuff after being evicted is expensive. Not being able to fill your gas tank takes up precious time in your life. All of these are often things that those struggling with poverty lack. I will now pass it back to Jenita to talk about trends in poverty and differences by race, ethnicity, gender, and household structure in the United States.
Poverty started to decline around 2014, and by 2018, the poverty rate had been the lowest it had been since 1959, at 11.8%. However, that low rate was short-lived because COVID-19 pushed up the poverty rates. So in early 2021, researchers at Urban Institute projected that the poverty rate would climb to 13.7% in 2021. This corresponds to approximately 6 million more people in poverty. Urban also estimated that a third of these people would be in deep poverty, meaning that they're living on less than 50% of resources defined by the supplemental poverty measure. Additionally, almost half of Americans and over half of children would be categorized as low income, meaning that they are living at or below twice the poverty line. Citations for these statistics are in the handout accompanying this webinar. Poverty is not random. It is not distributed evenly across various groups of people. People with fewer opportunities because of their race or ethnicity, because of their gender, background, or geographic location are more likely to be poor. Even when there are small fluctuations, American Indians and Alaskan Natives consistently have the highest rates of poverty, followed by Blacks and Hispanics. Asians and then white Americans have the lowest rates of poverty. These disparities are the result of structural racism that has impacted who in this country has access to opportunities and can build and hold on to familial wealth. Similarly, female-headed households are more likely to be poor, and nearly half of single female-headed households with small children are poor. Children are also more likely than either working-age adults or the elderly to be poor. And those living in rural areas are more likely to be poor than those in urban areas. Graphs and citations for these patterns are all shown in the handout for your future reference. This short clip shares examples of how poverty is experienced by young people today. In their own words, they share how multidimensional poverty is.
I was born by the river in a little tent. And oh, just like that river, I've been running ever since. What was supposed to be our room had like a dead lizard skeleton in there. And we were sleeping on the floor. You know, there were always like gnats around the bananas that we had. And in the backyard, the grass was like really high. It's been a long time coming, but I know a change gonna come.
We couldn't afford the house that we were living in before Dad left anymore, so I think the bank took the house, and so we had to move, and then we moved again. I think in the course of 4 or 5 years, we moved in like 7 different houses or something crazy like that.
When my dad left, we were struggling a lot because my mom is disabled and she can't get a job to help to pay for the bills, get food.
I lost a lot of weight. I remember I used to be a size 5, and I went from a size 5 to a size 0. So, you know, I try to not eat too much. I try to eat in school.
There was nights where we didn't have anything to put in our stomachs.
It's been too hard living, but I'm afraid to die, 'cause I don't know what's up there beyond the sky.
I remember sitting at the gas station, she's putting like 50 cents in the gas tank, and I'm like, I see other people, they're putting $20 in. Like, why are you doing that, Mom? And I asked her one day, I'm like, why do you put so little in? She's like, I don't have money to get to work.
She worked 4 jobs. There were days where like I hardly saw her at all just because she was working so much and she was always tired. And like it was really difficult to make ends meet.
When you're homeless, you don't have too much to call your own. So, you know, food is when you don't have money, you don't have clothing, you know, food is definitely a necessity or a concern. You know, even still to this day, we have, you know, troubles with food.
The first couple of months at the shelter, I felt like I was losing myself. My grades dwindled, my spirit died, and I didn't really want to do much.
You know, when you're kids, you kind of like want all these things, and when you don't have the money, you kind of, you know, you're kind of sad. You're like, I kind of want it, but I can't have it.
It was just kind of like chaotic, and it just very, I don't know, it didn't make you feel very like secure about anything.
It's been a long time coming, but I know a change gonna come. Oh, yes, it will.
It's easy to look at graphs or statistics, or even listen to the film and continue to have a somewhat narrow understanding of what poverty looks like. Maybe it's easy to say poverty is being homeless or poverty is being hungry, but the kinds of day-to-day decisions that many families in poverty or on the cusp of poverty face are varied and complex. Poverty for different families might mean different things. The slide lists a couple examples. We won't go through each of these, but just to give some context. In 2018, nearly 40% of Americans said that they did not have $400 right now that they could use in the case of an emergency expense. We also see that many Americans in poverty skip needed medical care because of the cost. The most commonly skipped medical treatment is dental care, which almost 1 in 5 households report skipping, and 1 in 10 people report not getting needed prescription medications. Finally, many Americans struggle to get credit, which can limit the ability to access credit cards, mortgages, or car loans.
There are also important differences in the experience of poverty by race. This slide provides just some examples of differences that we see by race and ethnicity. Please remember that there are subgroups within many of these groups indicated here that themselves may do better or worse than others. And if you'd like more help in thinking about this in your site, your TA providers can absolutely help. So differences in race are important because historically, opportunity in the United States has not been equally distributed. Disparities across dimensions stem from both overt and covert racism embedded in systems that shape opportunity. Ongoing systemic racism continues to prevent people of color from accessing opportunity that is readily available to white people. For example, while racial discrimination in lending has been illegal since 1968, investigations found that Black and Latinx individuals are still more likely to be denied mortgage loans, and that they are more often directed to loan products that might be less viable in the long term. Practices like these perpetuate differences in opportunity through generations because they limit the ability of people of color to purchase homes, which contributes to a persistent wealth gap. As of 2016, on average, non-Hispanic white families had a net worth of $143,000, while Black families had a net worth of $12,900. This is just one example of how discriminatory practices create disparate access to opportunity. Some examples of Black-white differences are shown on this slide, and citations for these statements are included in the handout as well. So there have been some important anti-poverty measures enacted by the federal government since the beginning of COVID. Estimates of how much these impacted the poverty rate are varied, but they are the reason that many families stayed in their homes, and they're the reason that many families were able to navigate healthcare or job loss and had enough food on the table following a job loss. In March 2020, the CARES Act passed. In December 2020, the Consolidated Appropriations Act passed. And in March 2021, the American Rescue Plan passed. And perhaps most relevant to this webinar is the child tax credit.
Many of these poverty relief measures have had an effect on poverty, but the one we want to talk about a bit more is the child tax credit. The American Rescue Plan expanded the child tax credit for the year of 2021. For each child under 6, parents can receive up to $3,600 or $300 a month. And for each child aged 6 to 17, parents can receive $3,000 or $250 a month. The child tax credit payments are refundable, which means that you don't have to earn income to get them. They're not taxed, and most people will likely have them automatically deposited to the accounts they paid taxes from last year. However, checks will be mailed for families without a bank account who didn't file taxes or who don't earn income. The Child Tax Credit Update Portal, which is linked in the orange box on this slide, is where families who have new bank account information since their last tax filing or who didn't file taxes in the past can enter their direct deposit information or gather information if they don't have a bank account.
Great, thanks, Hannah. You as program leaders have noticed this year that you might need to spend a bit more of your time understanding many young people's realities and the realities of their families. This may be something you and your programs already did well, and you're here to learn more about what else you can do. We're getting there. But if you, prior to COVID, hadn't really thought much about what your role was in terms of knowing more about the situations of your participants and their families, here are some things to think about. You can think about parents' context and what's happening for them in your community. You can think about the impact of those contexts on your participants. You can think about whether parents are employed, whether they're struggling with food insecurity or housing instability. And you can think about how to provide a bit of normalcy without ignoring the challenging realities of life for so many young people. Some specific factors you might think about related to parents right now include that parents are maybe more likely to be unemployed now. Unemployment may increase youth rates of food insecurity, contribute to instability of home life, or lead to housing instability and more. Another factor is that parents might be required to work outside of the home during COVID-19 and might be at further risk for their health. This might increase youth's anxiety and concern for their parents' physical health and well-being, as well as their own. And a lack of supervised, safe opportunities outside the home may mean more students do not have regular or reliable parent supervision. On the flip side, some other parents and caregivers may be working from home more. This may mean more people relying on one computer, or shared workspace, shared internet connection. It may also impact how comfortable youth are in your program in terms of talking about sex out loud. So reaching out to parents to identify what needs they have that might impact both families overall and your participants might be important.
On this slide, we list a number of actions that your organizations might think about doing to support your participants. While your prep programs likely cannot do all of these things, this list might help you think more broadly. First, it can be helpful to have conversations within your organization about which of these you do now, which you might be able to easily address, which ones you might think about partnering with other organizations or developing referral lists for, and which are just too far from your mission. You can remind both participants and parents about your organization and that you are available to support them. Let them know what kind of services your organization is offering right now and the ways in which you can assist them during this difficult time. Some of you are part of much larger institutions that might provide a variety of supports, whereas some of you are part of significantly smaller organizations that may only provide some of these supports or would need to partner to provide others. In terms of partners, this is a good time to reach out to your referral network and to partners to see what kinds of services they can provide during this time. You will want to understand their own capacity before referring families for services, as getting turned away from a full program elsewhere will be challenging. You also want to make a warm handoff. Referrals are most successful when they are warm. To do this, be sure to connect the family directly to your referral contact rather than only providing a slip of paper with information or a website. Also, be sure to follow up after referrals to make sure that families got the help they needed. Additionally, if parents are home more, this is a unique opportunity to strengthen the parent-adolescent relationship. By increasing parents' skills for communicating and connecting with their adolescents, your organization can make it more likely that their adolescents will avoid sex and other risky behaviors and perform better in school during this difficult and stressful time. Finally, we know that sometimes there is little you can do to change the circumstances that a young person lives in. However, you can create creative outlets where your participants can have fun and feel safe. When your participants feel safe, they may be more open to sharing and reflecting on parts of their lives. This can in turn help you link them to additional resources or simply support their emotional and reflective processes while allowing them to feel safe and supported in age-appropriate ways. Resources around positive youth development more broadly are on the exchange, but on this slide, we share some examples of more creative outlets. Grantees can create opportunities for written projects for youth to share if they'd like to do so. Grantees could create opportunities for youth to express themselves in other ways, such as drawing, collage, or taking pictures to share. Participants could create a joint music video or lip sync that could be recorded individually. They could choreograph a dance together and stitch together the pieces. They could plan to paint a mural on a wall somewhere where youth come in small groups that can maintain distance. Or you could put a play on over Zoom. The link on the website to Woolly Mammoth has some plays at home that young people can do. We're now going to move on to some stories from prep grantees who will share some real life examples of working with young people in poverty.